Hey everyone, welcome back to the Medical Certificate Program. Today we're going to be focusing on Module 2, which is the Digestive and Excretory System. All right. The goals for today, one, I want to give you a quick overview of each system, and two, I want to go ahead and give you some real-world examples and let you know how this connects to the medical field. Brief descriptions of the digestive and excretory system. Let's start with the digestive system. Well, first off, it's responsible for all digestion and all absorption of nutrients. As you can see, there's a lot of breakdown of food into smaller particles. Next, we're going to focus on the excretory system, which is responsible for all elimination of waste out of our bodies. All right, here we go. The digestive system, as you can see here, here are the main structures: the mouth, the esophagus, the stomach, the small intestine, the large intestine, the rectum, and then the anus. Before we really get started, I want to go over two main things. One, you need to know the difference between mechanical versus chemical digestion. Mechanical digestion is pretty much any physical breakdown of food, and the chemical digestion is pretty much any chemical breakdown of food using enzymes and or chemicals. You also need to know the 4 macromolecules of living things. We're going to focus on carbohydrates, proteins, and lipids today. And nucleic acids is number 4. Well, what in particular? Well, the chemical digestion. As you can see here, starch is a very big, long polysaccharide. However, our bodies use glucose. So how are we going to break down that long molecule into a smaller molecule? Well, we're going to go ahead and use enzymes. Okay, same with protein and or fat. Let's go ahead and begin. First stop, the mouth. So within seconds or even a minute, depending on how long you choose to break down your food, your teeth will grind, crush, and tear it. Well, as you chew, your salivary glands are going to go ahead and release some saliva. And within your saliva, there's the first enzyme. As you can see in red here, amylase. Amylase is an enzyme in your mouth that breaks down carbohydrates. Okay. So in class, we do a demonstration where you chew on a cracker, and then over time, you can tell how the starch becomes glucose, a sweet glucose. Here are some examples of carbohydrates in your ordinary day. The esophagus. Within seconds, the mouth moves food down the esophagus, which is that little tube, as you can see there in the picture. There's a couple of terms you need to know here. One, peristalsis. How does your food get down from your mouth all the way down to your stomach? Well, there's wave-like muscular contractions that push the food down towards the stomach. You could even hang upside down, and the peristalsis will go ahead and take your food up against gravity into your stomach, depending on what your food is. 2, I want you to know what the cardiac sphincter is. The cardiac sphincter is the gate between the esophagus and the stomach, and it just naturally allows food into your stomach. And finally, the epiglottis. The epiglottis covers and protects your trachea. So you have 2 pipes. I can go ahead and show you some pictures here. You have 2 pipes that go down your body. One, as you can see in the larynx in the picture, is your windpipe, and that's in front of your esophagus. Now on the back, you can see the esophagus. As you naturally swallow, the epiglottis is that little flap of tissue there that covers the windpipe from food going down it. Now, of course, if you talk while you eat, etc., of course, food can go down your trachea, which is shown there by your larynx, but that could also be very dangerous. And we also have a natural gag reflex there as well. Now, the other term that we just learned about, peristalsis. As you can see here, wave-like muscular contractions are bringing food down from your mouth down to your stomach. Okay. Now it gets down to your stomach, then what? Well, first off, the average stomach can hold about 1 liter of food. And of course, you can train your body to hold more, etc. What happens? Well, muscles contract to churn and mix your food into a substance called chyme. Throughout this process of churning and mixing, these mechanical breakdown, there's also some chemical breakdown. Now the enzyme here, actually the chemical is called hydrochloric acid, which is HCl, which is a very strong acid that is in your stomach, and also pepsin. Okay, so pepsin is the enzyme that's going to go ahead and break down proteins that you have. So how does your stomach not get a hole burned through its wall because of the strong acid? Well, mucus naturally lines and protects the stomach wall. And then I'm going to go ahead and talk about heartburn, etc. Here are some examples of proteins in your daily diet. Now, real quick, I want to talk about two life-relevant scenarios. So one, heartburn. Maybe you've heard of it. Maybe you've seen some commercials on TV. Heartburn isn't your actual heart burning. Heartburn is actually that stomach acid actually coming out of your cardiac sphincter and up into your esophagus. This could be due to age. It could be due to overeating. This could be due to specific foods that you eat. It could be due to stress or sleep. It can be due to smoking. I mean, like, there's so many different instances as to where heartburn can happen. Now, the reason why they call it heartburn is because it feels as if your heart's burning, but that's actually the acid coming up into your esophagus. Another life-relevant scenario I want to talk about are stomach ulcers, as are really important. There's a specific bacteria here that I've put up here called Helicobacter pylori. And in short, if these get into your stomach, then they can actually create ulcers. So you can do some more research into that if you are interested. So as you can see, here's a progression of what happens in your stomach during a meal. 1 to 2 hours after a meal, and then 3 to 4 hours after a meal. You've got to take care of your stomach, as you can see in this picture right here. Next is the small intestine. The small intestine, in my opinion, is the MVP of the digestive system. About 8 to 12 hours. Now, all these times are averages. For each person, it can really fluctuate. In addition, what are you eating, how much fiber are you eating, etc. So all these times here are estimates. Now, the pyloric sphincter is the sphincter between the stomach and the small intestine. Next, most of the chemical digestion happens in your small intestine. Now, what are broken down? Well, all macromolecules, pretty much, specifically proteins, carbs, and lipids. In addition, we're going to talk about some accessory organs, like the liver and gallbladder, which secrete bile into your small intestine as well for fat breakdown. If you look at the small intestine, there's a lot of villi. And in short, these are little folds. They're like finger-like projections that increase surface area to maximize the absorption of nutrients. Now, your food after your stomach goes into your small intestine, and it's going to slowly move down your small intestine. And this is where, as you can see here, I'm zooming on a villi here. Within each villi, there are capillaries. And in short, this is your bloodstream. So all the nutrients can be absorbed into your bloodstream, etc. Okay. Quickly, I want to show you a video of an endoscopy. And in short, an endoscopy is a non-surgical procedure, usually like you go through your mouth, to check a person's digestive tract. Now, what do you want to check it? You want to see if there's any infected, damage, or cancerous issues with your system. So real quick, I'm going to go here. Show you a quick video here. So as you can see in this video, here's the physician, and he is manipulating the tube with his left hand, and then on the right there's a flashlight. It kind of looks like Harry Potter or something, but that's the tube that's going to go ahead and go down the digestive tract of the individual. I think he's also going to show you here, like he zooms in on the fabrics here of the patient's attire, and as you can see, like there's a lot of clarity and there's a lot of detail in the camera. Here's a picture of their hair, etc. So I'm going to go ahead and pull up another video here, which is the next portion of the video. So this is pretty cool. As you can see, there's a tongue right there. That's the epiglottis, and that's the tissue that allows food not to go down your trachea when you swallow. As it continues down, he's going to go ahead and slowly push. This is the inner picture of the esophagus. Pretty cool. And we're going to make our way to our cardiac sphincter, which is this little gate that gets into the stomach. Very cool. And I just want to show you right here. This is the inner wall of the stomach right here. There it is. I think we call that rugae. Okay. And then he's actually gonna, so this is the small intestine. As you can see, there's little villi that are very small. He's gonna take a sample here to go ahead and test, to examine further. Okay, so there's an endoscopy. Let's continue and finish this presentation here. What's the difference between the small intestine and large intestine? As you can see here, the small intestine is called the small intestine because it has a smaller diameter. Of course, it's longer, but it's a smaller diameter. That's why they call it the small intestine. Versus the large intestine is larger in diameter and it's a little bit shorter, or actually way shorter, as you can see there in the numbers. Here's a little chart telling you mechanical and chemical digestion in each of the steps that we just covered. Now it goes to the large intestine. The large intestine really has one function: to remove all the final water from all your food. Okay. Next, everything will be pushed out of the rectum and the anus. The rectum is a temporary storage unit, and the rectum is the opening of the lower digestive tract that controls an expulsion, the expulsion of feces, which is your poop. There's also some accessory organs that I want to quickly cover. There's the pancreas, the liver, and the gallbladder. These are super important. Food does not pass through them, but they're important because it allows the small intestine to break down all of the food chemically, etc. So we just finished the digestive system. Now let's go on to the excretory system. The excretory system is responsible for the elimination of waste out of all of our bodies. It includes the kidneys, the ureters, the urinary bladders, and the urethra. Okay, kidneys. In short, how does it work? Blood travels to the kidneys via the renal arteries. The blood gets filtered in the kidneys using the nephrons, etc. There's a whole process in here, but I kind of see it as a filter. After the blood goes through the kidneys, it goes back to the heart via the renal vein. And then the urine leaves. So the urine is pretty much all the nitrogenous waste. And it goes through a duct called the ureters. And then it travels to the bladder where it's stored. And then finally it's expelled through the urethra. Okay, so in short, there's a quick summary of the urinary system. If you're interested, go ahead and take a look further at it. I want to go over a couple of specialties that deal with the digestive system. And in the spring, it is my goal to go ahead and get a couple of these people to come in. Let's start with the gastroenterologist. In short, these physicians specialize in diseases of the digestive system, including the esophagus, stomach, and intestines. They don't really do surgery, not that I know of in the research that I took a look at. But in short, these are people that specialize with the digestive system. Now, anyone that does a surgery would be called a general surgeon. Now, they treat and they prevent diseases, they repair damages by injuries, they correct deformities, and they improve the functions of the human body. They may remove things, they may do colonoscopies, so that's different than an endoscopy. A colonoscopy would be through the rectum and up the other way to check for polyps or for cancer, etc. Okay. Other procedures range from cosmetic surgery to organ transplants. One of my friends is a radiology technologist, and I thought this was pretty interesting. They deal with all of the imaging procedures, x-rays, CT scans, MRIs, and they go ahead and analyze as well. So that's a pretty cool career. If you're not interested in the doctor route, there's definitely some programs there for you as well. Another program other than the doctor route would be a surgical nurse. These are specific nurses that help out during surgeries. As you can see there, you can read down, they help out before, during, and after surgery with a patient. And then we have a urologist. A urologist is a medical doctor who specializes in treating diseases and maintaining the health care of male reproductive organs, as well as the urinary tract in males and females. And then you can also help patients with questions in kidneys, the adrenal glands, and the bladder. Thanks so much for watching Module 2. And I hope you're enjoying this learning process. And then in the spring, we're going to hear from many of these healthcare professionals. And the hope is that at that point, you're going to be a lot more knowledgeable through these 10 modules. Have a great day. Bye-bye.